and Zyga Healthcare Group. Dallas Renal Group provides comprehensive kidney care, including transplant and home dialysis services, and information can be found on dallasrenalgroup.com or the Dallas Renal Group Facebook page. This show is also sponsored by Comfort Care Hospice, which is a subsidiary of Zyga Healthcare Group, and they're a leader in providing hospice-related services throughout the entire DFW Metroplex. Folks, my name is Dr. Parin Makadia, and I will be co-hosting today's show with Dr. Samir Nangia. More details on our show can be found on our website, doctalklive.com. Again, that's DOCTALK live.com. And while you're at it, please head on over to our new YouTube channel, Doc Talk Live, and like, comment, and subscribe to see more of us speaking on topics you would love to hear about. And if you are a healthcare professional and would like to be on our show, please send us a request through our website, Doc Talk Live, or through our Facebook page. Now, before we begin the show, I wanted to make a quick announcement for a really good cause. Sankara Eye Foundation is presenting a concert called iTunes 2017, and that will be held on November 11th at the Eisman Center in Richardson. And the proceeds from this concert will go towards construction of 2 new eye hospitals in Indore as well as Hyderabad. So folks, stay tuned in the upcoming weeks for more information.
Good evening, Phonesia listeners. This is Dr. Samir Nangia, your co-host of Doc Talk Live, and it's great to be back in the studios with Dr. Parin Makadia. It's always an exciting day to work with him. Today, ladies and gentlemen, we have a wonderful show. We're going to be talking about kidney disease, and we're also going to be talking about high blood pressure. And most of us know someone in our family who has high blood pressure, or even ourselves may have high blood pressure. So it's a very important topic. The studio is 972-235-5555. Again, the number is 972-235-5555, and we'll take your questions live throughout the show as you call in. I wanted to thank Dr. Verma and Dr. Racheruvu. Welcome to Doc Talk Live. Thank you very much for volunteering your time to be part of the show. Maybe we can start out with Suneet. You tell our listeners a little bit about yourself.
Thank you. Good afternoon, Dallas. This is Dr. Suneet Verma. I'm one of the nephrologists here with Dallas Renal Group, and I practice out of Plano. Most of my practice, I have 2 practices there, and I enjoy taking care of kidney patients over there. You can find more information on dallasrenalgroup.com, and you'll find all the addresses, telephone numbers you need to reach us, and feel free to do that.
Hello listeners, this is Dr. Mamatha Racheruvu, nephrologist in Dallas Renal Group. I moved to Dallas about 2 years ago, and I practice in the San Francisco area. You can again find more information about us at dallasrenalgroup.com, and thank you for having me here today on Dr.
Excellent. Thank you, Dr. Verma and Dr. Racheruvu, for being our guest today. Let's get right to it. So our first question is for you, Dr. Verma. Now, you know some of the statistic that CDC reports that 30 million people, or about 15% of U.S. adults, are estimated to have CKD, or chronic kidney disease, and about 48% of them have severely reduced kidney function, but they're not on dialysis yet. For that matter, can you explain to our audience what is chronic kidney disease, or CKD, that's for short, and what are some of the signs and symptoms of CKD?
Sure, Parin. Thanks for that great question. I think it's very important for all of us to understand what is chronic kidney disease and how is it different from just renal failure or whatever, because a lot of patients think that chronic kidney disease means kidney failure. So by definition, unfortunately, there are a lot of different organizations which have tried to define chronic kidney disease in different places and in different format. But in all practical purposes, what is helpful to me as a clinician is that it's a disease where you have abnormal kidney functions which last at least 3 months, and you can find abnormalities either in your blood test or in your urine test, and also abnormalities if you just do an imaging study on the kidneys. So you need to have either a functional deterioration in your kidney function, or you should have an imaging test result showing some abnormality in that. Often when you go to the kidney doctor, they will do your urine test, your blood test, and when you find those abnormalities, it can qualify to be a chronic kidney disease. But how do you know it is not acute? Is by that duration of time. So it's very important to know that these things last 3 months or longer, then you call it chronic kidney disease.
I think that was a great explanation. For those who are joining us, you're listening to Doc Talk Live, and if you have a question on kidney disease or high blood pressure, the number to the studio is 972-235-5555. Again, the number is 972-235-5555, and our experts here from Dallas Renal Group will be answering your questions. Mamatha, maybe you can go over what the different stages of chronic kidney disease and what particular age group is affected by chronic kidney disease.
Sure. So stages of chronic kidney disease is we stage basically depending upon GFR, which is glomerular filtrate rate. Basically, it's nothing but percentage of kidney function. So we stage from stage 1 to 5. Stage 1 is when you have greater than 90% of GFR, but you do have risk factors like diabetes and hypertension. Stage 2, your kidneys are working around 60 to 89%. In stage 3, 30 to 59. 4 is 15 to 29%, and less than 15% is stage 5. Majority of individuals classified of having CKD or chronic kidney disease is over 60 years of age. It's basically a reflection of age-related disease and kidney function.
Great. Again, for those who are just joining us, you're listening to Doc Talk Live. The number to the studio is 972-235-5555, and we'll be answering your questions on chronic kidney disease and high blood pressure. Hi, you're on the air. What's your question for our experts? Uh-huh. Oh, wow. Okay. Okay, those are great questions, and I know that's a lot of information for some of our listeners who may not know what these numbers mean. So creatinine is how we tell how someone's kidney function is. A creatinine of approximately 1 is normal. A creatinine of 2 is about 50% kidney loss. So you can imagine what a creatinine of 11 is. So he is on dialysis, and maybe Dr. Verma, you can comment a little bit more about what happens when your creatinine is 11 and who's eligible for transplant and what are some of the things you can do.
So thanks for that question. It's a very unfortunate situation. It looks like your uncle probably had a very advanced kidney disease. When your creatinine reaches 11, that probably tells us, unless it was just happening overnight, where there could be some other reason, but looks like it probably has been developing over the period of time. And when you reach that stage, your filtering capacity of the kidneys is already too reduced. I mean, I don't know how much urine output he makes, how much urine he makes every day, what his symptoms are, but as these kidney functions deteriorate, people start having shortness of breath, they cannot breathe properly, they cannot function, their appetite goes down, they have nausea, vomiting, and all those symptoms. Now, to put someone on dialysis, it's not just pure number. You need to look at the patient itself. If they're having all those symptoms, which we categorize as uremic symptoms, if those symptoms are there and the kidney functions are getting worse, yes, the dialysis is the right thing to do at that point. Now, in most of the studies, we have found that people who can get transplant, they do better than people who had been on dialysis for a long period of time. But it's not easy to get transplant, as you know, the organs are in deficiency there. So if there is a way that someone can get transplanted, that would be great. But meanwhile, you have dialysis as an interim measure to take him through that process and make them comfortable right away. Otherwise, they will have a lot of symptoms. Transplant in India, I don't know much about it, how it's going out right now, but in the United States, we have a waiting period and there's a list and there's a protocol. To get more information on that, we have a transplant nephrologist in our group. And if you need more information, you can definitely log on to DallasRenalGroup.com and find out. And I think you should get in touch with a transplant nephrologist, which is a specialty training even after we do nephrology, who can talk more about how the new organ allocation system works and who can get at what time. that transplant.
That's an excellent point that Dr. Verma brought. So just to sort of add on to it, we're actually going to have a transplant nephrology as well as a transplant surgeon at the end of this month doing a show on kidney transplant. So stay tuned for that show, and you may want to call in and ask that question again. But we're going to continue with our live caller. Welcome to Doc Talk Live. Your questions for experts.
So what is the top number usually when you check your blood pressure? And 140. Has it ever gone higher than 140? Okay. Well, I'll let Dr. Verma answer this, and maybe you can go over what the top number is called and the significance, and then the bottom number.
Again, it's a very interesting question. It's very important to know what is hypertension, and you do not necessarily have to have both the systolic blood pressure and the diastolic blood pressure to be higher. You can have an isolated hypertension when the top number, which I call systolic blood pressure, is higher, or you can have when your lower number, which is diastolic blood pressure, to be high. And these isolated hypertension are equally important to be aware of. And when you have these numbers higher, like as you're saying, now I think what you are trying to tell me is that these numbers you're getting on your automated machine which you have at home. I think it should be collaborated with what your numbers are at the doctor's office when they check it with their hand and the pulse. They check those accurate measurements. You need to have at least 2 readings in each sitting over two different visits by definition to call it hypertension. Now, if these numbers persist, by definition, normal blood pressure is less than 120 by 80. Now, if you start going above 120 to 139, it has become pre-hypertension. And the lower number, the diastolic pressure, if it is between 80 to 89, that is also pre-hypertension. Beyond 140 and 90, that becomes hypertension. So it's very important to have those numbers measured properly. There is a way to do the blood pressure properly. You should be rested, and knowing those numbers is important. And then once you have these higher numbers, 95, 110, you need to touch base with your doctor and get some help with that, because if it is consistently high like that, it can affect your life in general over the long period of time, and it will be diagnosis made by your doctor. So I would recommend you to do it proper, adjusted blood pressure monitoring and measurement at doctor's office, and then you can ask us any question how to manage it.
You guys have asked some great questions on the first part of our show. We're about to go into the break. Call us during the break. The number of the studio is 972-235-5555. Again, go to our website, doctalklive.com. We're going to be back in 5 minutes, and we'll talk more about high blood pressure and chronic kidney disease.
There are luxury jewelry and timepieces every day.